Hello, everybody.
Hi.
Hello, welcome to the COVID Community Champions meeting. I'm just letting a few more people in from the waiting room, so we'll wait for them to join us before we start. There we go.
I'll keep an eye on it. I'll keep an eye on it, Tracy, as well.
Thank you very much. So my name is Tracy Leach. I'm a community development worker with Wakefield Council, and I'd love to welcome you to our COVID Champions meeting. And we'll start, as ever, with our Director of Public Health, Anna Hartley.
Hi everyone, thanks so much for coming today, and it's a little bit different from a normal meeting, and we'll just talk about that in a couple of slides time. So if I could just have the next slide please, Tracy. So this meeting's being recorded, as you know, so just anything, if you want to say something anonymously, just put it in the chat. Just to say as well that we've had, as you know, the Community Champions approach has attracted a lot of interest, and I've been chatting to the BBC about wanting to do some a programme or something on Wakefield as a place and all the things that we're doing, particularly around helping people to help themselves. So as such, they'd really like to attend the Community Champion session next week or the week after, because I'm on leave next week, so it might be better the week after. So if you wouldn't be comfortable with that, if you just let Tracy know, again, it obviously it will ensure we keep things sort of anonymous and confidential for people where necessary, but just let us know. But I think it's just a really nice recognition really of some of the great work that you're all doing, and they would also like to hear any stories of people who've done stuff in their community, made things safer, protected people from COVID. So if you have any of those stories, I'll send an email around, but please do let me know, and we'll share that. If you'll be comfortable talking to the BBC about those, we'd love to hear them, so thanks. So we're going to start with some certificates of appreciation for all that you're doing, and we know that you share the information we give you with thousands of people via all sort of mechanisms, community notice board, social media, and we're really grateful. I think we've been doing these calls for nearly a year now, and they're incredibly valuable. So I just want to introduce, we've got two people here today who will be just saying a few words and then doing virtual certificates. So we've got Andrew Balchin, who's the Chief Exec of Wakefield Council, and Adam Shepherd, who's the Clinical Chair of the CCG. So just want to welcome them here today, and I'll hand over to Andrew, I think, to say a few words, and then Adam.
Thank you, Anna, and hello everybody on this weird and wonderful world of Zoom that we've kind of got used to. Thank you to all the colleagues who've invited me along today. It's a rare privilege really for me to join this meeting. I've heard so much about the work that's gone on and the work that you've been doing as community champions, and it really has been one of those kind of lights really that's kind of helped the rest of us to see the value of local communities and local residents, and keep us all going. I think we've all needed kind of little glimmers of hope and encouragement, and for me personally, and I know for many of my colleagues, you have been part of that light that has kept us going. I was reflecting just a little bit as well when I was asked to kind of put my signature on the certificates that we're kind of having to hand out virtually, about what are the things that have been really important as we've had to kind of collectively face a situation and challenges that none of us ever expected to face in our lifetime. And I guess the two words that came to mind for me were trust and togetherness, and that if we are to achieve more by working together and supporting each other, then those two things mean an awful lot. And I think that's the difference that you have made, that certainly in relation to the kind of rollout of the vaccine and getting good messages out to local communities. Local councils are not always the best people to do that, and people trust those who are close to them, who are in their local communities, who are perhaps more visible, and that's the difference that you have made to that kind of collective effort, working alongside so many other colleagues. And also it's kind of brought that sense, I think, of togetherness, and that we are facing a sort of common challenge, and that we all have a part to play, whatever that might be, and every part is equally valuable and valued. So I really just wanted to add my thanks today, and also, I guess, express a hope that your contribution, and I hope you've gained personally from the contribution that you've made for others, is something that we can all continue to nurture and support in the months and years ahead, because whilst we all hope that things are going to get much, much better quite soon, the lingering impact, I think, on people, on communities, is going to be with us for a long time. And if we're going to recover and come together out of this, then I go back to those two words about trust and togetherness. And that will be just as important as we go into a kind of recovery phase as it is whilst we're in the thick of tackling the coronavirus. So with that, I've probably run over my allotted time. Apologies if I've gone over the 30 seconds I was supposed to have, but I don't care. I'm going to say it all anyway. So thank you very much for letting me join you today, and I'll hand over to Adam.
Thank you, Andrew. And again, thanks from me for the invite. This is a privilege. I live in Wakefield. I've been a GP in Wakefield for nearly 30 years. And I've seen a lot of change. This year has been the most challenging I've ever experienced, however. But I look at it as sort of a view from the bridge, a bit of a privileged position, obviously overseeing health, seeing things from a GP perspective. But I know what's really important is what's happening to each and every individual in this patch. And that's where you colleagues have played such an important role in terms of, sorry, my screen's just changed, in terms of what you've been doing. I'm really proud about the volunteer movement in Wakefield, and I'm working closely with Anna Hartley, looking at things like health inequalities and how we can improve people in real communities, improve people's experiences. And that's about empowering people to actually help others at a community level and at a personal level. And that's what you have been doing. And I think COVID has brought about an awful lot of concern, mistrust about data, concern about having vaccinations, etc. And it's okay for me to sit here as a doctor and preach, but actually to have somebody personally to come and talk and allay fears, I think is so valuable. And obviously that has spread. I've heard the movement has expanded up to a large number of volunteers now. And that is really gold. And I think in everything that we do to spread community, I suppose community champions, community movement is the way forward in terms of everything that we do. So again, thank you so much for everything you've done. And it's really privileged for me to work in Wakefield. And, you know, I've heard some of the good things that have been going on, particularly around vaccinations, which have been challenging. And, you know, we're really getting there. So, yeah, it just remains for me to say thank you, enjoy the meeting. And again, thanks for inviting me.
Thanks, Adam. That's great. And you know, just I think on screen you can see some of the amazing achievements of the community champions. And bearing in mind that we haven't really done loads of publicity to recruit champions, we've just had people kind of come to us. And we've got over 131 community champions, and of those, it's really interesting to see that 90% of them spend between half an hour and an hour a week sharing messages and engaging with the community. And we've got examples of people who've set up community notice boards, all sorts. So it's really, really great. And just some of the things on there, you know, we know that people have made videos to help share messages in different community languages and also British Sign Language. And you know, amazing. And then because it's kind of a really organic process, so for example, when we put on training around conversations training, over 50 of the champions have attended, which you can see from the slide. So so it is a kind of really natural way, I think, to kind of grow that and sort of harness that kind of community sort of desire to be involved. And we've learned as much from the champions as they've learned from us, because we've had so much really, really valuable feedback. And I think Dasa's on the call. She's been fantastic at sort of picking up individual stories and issues and taking those back through the right channels to support those individuals to get the sort of right care and support. Yeah, so just some other sort of really nice infographic, but obviously some other kind of things that the community champions have done. So we've had really good take up of these meetings every week, between 30 and 50. And I remember one particular highlight for me was when a parent attended the meeting. I think 3 or 4, maybe there probably was only 2 children, but sat on their lap and they were kind of part of it and could ask questions. And it's just, you know, I don't think we really engaged it with digital, and we'd often sort of do something at a venue, but actually that's really difficult for some people to get to. So it's been so brilliant that we've been able to engage with people that wouldn't otherwise have been able to attend. And as we've said, our commitment is is to continue these sessions, you know, for the foreseeable future, really, to sort of look at other areas. And then, you know, just some other examples. I won't read them all out so you can see them, but, you know, trusted message givers. I can't believe we've had 40 since the summer. But yeah, really, really valuable, both from our end, our perspective, very much so as well. Yeah, so these certificate of appreciation, it comes sort of very heartfelt from us, and from, you know, as Andrew and Adam have described, and we'll get those sent out to all of you. I know it's just a bit of paper, but I suppose we wanted to kind of recognise a bit more formally some of the value that this you know, this network's had. And you know, it's such a simple idea. I think we definitely nicked it from somewhere, can't remember where, but you know, I think that we've used time and time again when we've been asked how we're sort of engaging, we've been able to use this network as a really good example. And you know, there's a lot of interest in it, and I think that really does recognise how incredibly valuable it is. And also, whilst I'm talking, and I will stop in a minute, I just really want to thank Tracy, Sarah, like other people who've done all the work behind the scenes. You know, Tracy is unfailingly cheerful, no matter what's thrown at her, and she, you know, without her this wouldn't have happened. So again, you know, really, really sort of important part of the team. So I know Andrew's got to go at 1, and I think Adam's got a full surgery as well. So thank you so much, both of you, for attending. Really appreciated it. Come back anytime you want to do some engagement, ask people questions, or share stuff that's happening with you. And thank you.
Thank you so much, everybody. Please enjoy the rest of the meeting, and please keep up the good work. Thank you very much.
Thank you, Anna. It's Tracy again. Could I just mention, please, although it's a virtual certificate and we will send out an emailed copy, if people would like to have a printed copy, if they could email us, please, at ccc@wakefield.gov.uk. We'll put their names on if they tell us what full name they'd like putting on the certificate, and we'll post a copy to them. Thank you. I'll put the email address in the chat.
Thanks, Tracy. Right, so I'll do the intelligence update. It's a bit shorter today, in part because I think we've got quite a lot on the agenda. We've got a question and answer session as well. So if you could just give me my first slide, Tracy. So just to sort of cover off some of the kind of key essentials this week. So this is the kind of most recent published data, 131 per 100,000. I don't know whether I should tell you this or not, but unfortunately, Wakefield District has the dubious privilege of having the 3rd highest infection rate in the country today. So we're the highest in West York, in Yorkshire and the Humber. So I don't really know what to say about that, apart from the fact that we are doing lots of testing, so we're finding those cases. We don't think anything particularly odd is happening. We think it's probably just the way that the data goes. Our numbers are reducing, albeit slowly. So the latest figure today, which isn't validated, but is 106. So we are seeing those numbers go down. And in terms of impact, which I'll move on to, that impact has significantly lowered. Our vaccination rate, and I think Emma's going to talk about this, is really, really good, better than the rest of the country. So hopefully it's just a blip, and we'll continue to see that rate reducing. It's not really a privilege that I want to have, to be the 3rd highest in the country. So I just thought I'd show you a comparison slide to compare sort of West Yorkshire areas. So Bradford, Caldesdale, Kirklees, Leeds and Wakefield, and Wakefield's the light blue. You can see that we've more or less sort of tracked West Yorkshire, and now really we're pretty close together. We are just that tiny bit higher than everyone, which is pretty much the first time that's happened, because actually often Wakefield's been lower than everyone. So again, just need to keep a really close eye on that, but feel that we are doing everything we can. So again, just to show you this, which is something I get every day from PHE, which we don't normally show you, but if you look down that far right hand side, you'll see that that's the most recent data in terms of the numbers. So whilst the grey column is the validated data, so what I'm showing you is what's currently not validated, and you can see it's 106.8 for Wakefield, which is just a little bit higher than everywhere else, and higher than the Yorkshire number average. So I suppose the take-home message really that to give out is that it's just really about really maintaining that caution, and we've said this all along, but you know, there's that sort of sense, isn't it? Oh, the sun's shining, we can all go back out again on Monday, lots of things open, but actually unfortunately our rates are still quite high, so we really do need people to adhere to the guidance and be really quite careful. But just to show you, I mean, some of the better news is around hospital admissions. These are Wakefield patients in a hospital bed, and you can see that they really have reduced significantly, so less than sort of 30, and that's great because it's not just about infection rates, it's also about the impact that has on the whole system. And again, with deaths, you know, much more positive. So still, you know, we don't want to see any deaths. So we did have 6 last week, but when you compare that to how, do you remember when I was doing a few months ago, every week it would be that we're having about 30 deaths, and that really indicates the value of the vaccination programme and how effective it's been. Yeah, so we'll probably pick questions up I think a bit later in the question and answer bit at the end, so just make a note of any questions and we'll go back to them just so we can get through the agenda. So I think Emma's going to do this bit.
Yeah, hi Anna, thanks. So which by way of update on sort of where we are with the vaccination programme. So we have over 170,000 people across Wakefield vaccinated, and this date is taken from the 1st of April, so we'll even have more vaccinated as of today. We have vaccinated 94.9% of our over 50s, which is excellent, and a lot of work is ongoing to try and capture the remaining 6% across the district, and that includes our roving vaccination model, which is working with our gypsy and traveller communities, working with our asylum seekers and refugee communities, and working with our homeless communities. And within those communities alone, we've vaccinated over 700 sort of service user clients that traditionally don't access health services like the way the majority of us do. So I think that was really, really good news. And we're well on the way in delivering our second dose vaccination. So we've almost 19,000 residents covered with their second dose. So that again is an excellent news, and we'll even have more and more in the weeks to come. Those that have received the second dose are those that are living in our care homes and are those residents over the age of 80 years of age. So it's just a matter of time that the younger age groups will receive their second dose, as was with the first dose. And I think that's it by way of update, and we'll just save the questions for later on at the end, if that's okay.
Thank you, Sarah. I'm not sure who's going to talk about the roadmap. Is that one for you, Anna, just to give people a reminder about no earlier than 12th April? Thank you.
Here as well, who'll jump in if I get anything wrong, Sam. So yeah, so you'll be aware that obviously we are now on this roadmap, which is gradually kind of reducing lockdown measures, a lot slower than last summer, fortunately, but we still do need to be really cautious. And then so there were going to be a number of tests to say whether these indicative dates could be actual dates, and the tests were things like was the vaccine rollout still being successful, was the vaccine still effective against was it effective, were hospitals and the NHS overwhelmed? Well, not all of those tests have been met, so I would be very, very surprised if we don't just progress to the next stage on the 12th, which is Monday. And again, you can see the slide in front of you that we lots of things, loads of stuff happens on Monday. So all retail opens, personal care, libraries and community centres, outdoor attractions. So suddenly you're going to be going from spending Saturday going for a walk and making banana cake to having a whole range of activities available to you. What I would at this point, you can also do overnight stays, but just with your household, but no international holidays. And then there's some changes at the bottom you can see to kind of numbers of funerals and weddings. What I would say is I would just reiterate that just because you can do it doesn't mean you do have to do it. So just given how high our rates are, I would be really, really cautious still about some of the things you do, particularly if you fall within one of those vulnerable groups, until we've got our rates lower. So again, I just would sort of plead caution. If you remember what happened last August, when there was a huge explosion of people mixing again, and unfortunately that then did lead to this huge rise in cases, culminating in that peak in November. So yeah, I think we send these slides out so you'll be able to sort of to see that in more depth. Yeah, so I think we're doing a question and answer session now with Emma, Sam and Sarah. I'll hand over to them to answer these.
So the first question we had received was, we have a risk assessment in place. We had a risk assessment in place coming out of the last lockdown. Will we be able to use the same one coming out of this lockdown?
In terms of us from environmental health, I would advise on that you should always be reviewing your COVID-19 risk assessments and certainly checking that they're still in line with the guidance. There's lots and lots of information on the .gov website for particular sectors. I'm not particularly sure which sector this one has come from, this particular question, but certainly what we have got, and I know it's really difficult to navigate the system, but we have got links. So if anybody, I'm going to put our email in the chat box there. And if anybody has got specific questions for your sector, then what we can do is we can point you to the most up-to-date guidance, because it does take some sifting through, but there's a lot of information there on the .gov website. I would say, given the variants that we've had and just things like ventilation advice, lots and lots of has improved, and we know a lot more than what we did potentially when we came out of the last lockdown. And I think as such, a lot of information has been updated. So I would certainly urge anyone to review your risk assessment to see if it still is up to date.
Thank you. That question actually came from a craft and camera group, so I presume that's a small community group.
It came from the Portobello Craft and Community Group. We are a small group. Thank you.
And they also asked the second question, which is, what will be the rules on car sharing with one driver and two passengers not from the same household?
I would suggest on this one that the general rules still apply in terms of who you're able to meet outside, and we also have to consider that it's very difficult to get the space requirements when you've got people in a car together. If it has to be done, then we would be looking at ventilation, etc. But it probably would be looked at this stage for something that we would advise against until we're a little bit further in the roadmap. I don't know if anybody else wants to come in on that one.
It's Emma from Public Health. I think the kind of key message at the present, if you can avoid car sharing wherever possible, then we would please advise you to do that. You can obviously open down your window and that will give the ventilation in the car. You can obviously wear a face covering and that will obviously help as well, reduce your likelihood to catch COVID if it happens that one of you in the car becomes a case of COVID. If there's alternative methods of getting somewhere, like walking, for instance, or public transport to avoid car share, then that would be more beneficial. But as Sam says, I think we're just asking everyone to just remain cautious whilst we open up and go back to some element of normal.
Thank you, Emma. The next question then is advice on opening our community centre, and they have a book swap and a beer garden. And they were asking questions about a method of ordering and paying for things, pinch points like toilets, whether children were allowed to play in the play area, and what would they do about people who were non-compliant, and what support is available. And actually there are a lot of things there, but I think a lot of our small community groups might be wondering about the same things.
Okay, so there's quite a lot in that one piece there that covers a couple of different businesses. In terms of a beer garden, so looking at the ordering and paying, if you are an outdoor hospitality business and you're serving alcohol as part of that service, then the ordering and the food service and everything has to be done from the table. So taking the payments, the order service, and you have to make sure that you're seated all that time. If you are a hospitality business that doesn't sell alcohol, you may still go inside to purchase and to pay. However, you have to go outside and remain seated whilst you eat. In terms of the children play areas have been allowed to remain open during recent lockdown. But again, what we would say in that circumstance is there is an onus placed on whoever is operating that play area to make sure that it's cleaned down quite frequently, that it's managed in a way that it's COVID compliant as much as possible. And any children who are up and around, they wouldn't be allowed to have a drink with them. They would have to sit down and eat and drink at the table. I think we would have to look at that on a case-by-case basis, because it isn't a one-size-fits-all, and really that would be something something that we would ask to be picked up in a risk assessment. And again, similarly, when we're looking at pinch points like toilets, they are concerns for us. We've got a lot of our large beer gardens that have got seating for over 200 and sometimes 300, 400 people at one time. Whilst the seating's all been arranged, there is going to be a point in time where people will want to access toilet facilities, and we are asking that they are managed in the same way as any other queuing system would be in those premises. They have to be considered. And the other concern that there is around this, and I will just throw this in, is the weather. And what you have to do is you have to make sure that if you are operating a beer garden, you've got quite a lot of people there, you have to kind of bear in mind what may happen if we have what's happened over the last couple of days, where suddenly it's gone from sunny to suddenly there's snow belting down and everybody rushing to get inside. You have to consider all of these points, how people are going to get out, what the queuing's like. So that is one thing that would need to be looked at. With the community centre, there is quite a bit of advice and guidance on the .gov website. If you look at, I think it's called community settings, I will put some links in there. Certainly, we'll share some links after the meeting for all of these points with everyone, so that at least you've got a point of reference that might be more applicable than searching through all the relevant guidance. I think it isn't a one size fits all, and we would have to look at things on their own merit, but we can certainly share that information in the first instance, and what you can't get from there, you can come back to us and ask those questions directly. I hope that helps a bit.
Sam, could I ask just our infection prevention control nurse, Sarah, have you got anything to advise around sort of cleaning practices with this example question?
Okay, so a couple of things then. So for the cleaning, you need to follow the guidance which is available. I can put that in the chat for non-healthcare settings. With regards to the book swap, so what libraries are currently doing at the second is putting books in quarantine for 72 hours. So you might want to consider that if you are going to go ahead with a book swap. In terms of play areas, we always recommend that there is some hand sanitizer available, and the cleaning products are that which we'll put in that link. In terms of ordering and paying, obviously contactless where possible is preferred, but that's not always the setup for small community centres, that sort of thing. So it's about good hand hygiene. So once you handle money, then that's when you want to be either sanitising your hands or washing your hands straight after that, just so that there's no potential for transmission that way.
Is there anything, Sarah, that you can avoid around sort of frequency of cleaning? You know, the start of the day, the end of the day, just sort of if someone's operating their community group from 9 till 5, sort of what frequency of cleaning, sort of just regular practicing that they should be doing?
Yeah, so in terms of cleaning, then it will depend on obviously how much use the toilets are getting. If it's like Emma says, the best thing you can do is before you start your session, considering ventilation at the same time, so get doors and windows open as much as possible, and then frequent points throughout the day, but make sure that you just document when you're cleaning, because what you don't want to rely on is somebody else doing it. So you want to keep a check. In terms of, it doesn't have to be after every individual use, but it should be frequent, dependent on the number of people that are using the toilets. With regards to the pinch points, like Sam said, you need to look at how many toilet cubicles you've got, and the sinks. You don't necessarily want sinks in use that are adjacent to one another. You want that distance so that if you have got more than one person in a toilet area at one time, if they both go to wash their hands, there is that distance between the sinks. So although you may have 3 sinks next, adjacent to one another, you might want to take the middle sink out of action, which can just be done with some tape or something, so that people have got that space.
Thanks, Sarah. That's really helpful, real practical tips there, I think, for groups that we'll find helpful. Tracy, do you want me to hand back over to you to read the next question? I think that one will be aimed at Sarah as well.
Yeah, thank you. This was some practical advice on COVID safety in general about the PPE types of alcohol gel, how to do a one-way system, what guidance there is for getting closer than 2 meters for those people with disabilities. Do you have to wear a mask if engaging in sport or running? Can you share equipment, and if so, what clean downs need to happen, and how long does the equipment need to be quarantined for afterwards? Quite a lot there.
Okie dokie. Right. So let's start with PPE. So PPE is a last resort. What you should be focusing on is that you're putting all the other precautions and measures of reducing transmission in place first. PPE should only be worn if it was worn prior to COVID, or if it's in an environment that warrants PPE. So in terms of community groups, in terms of community centres, what you would actually just be wearing is your face coverings. You should be practicing your social distancing. You shouldn't necessarily need items of PPE. When you're considering cleaning, if you were, for example, cleaning a block of toilets, then even prior to COVID, you should have been wearing an apron and gloves, in which case you will still continue to use those. But it's very much thinking, what did I use before? So I should be continuing using that, not necessarily suddenly walking around with gloves and aprons on at all times, because unless you're in a healthcare setting, that PPE is not required. In terms of types of alcohol gel, so obviously there's lots of different products on the market. There's quite a useful page on Health and Safety Executive website, which I can put a link to that, which talks about the different types of gel that are available. At the end of the day, they can't sell them unless they've passed certain criteria, and the ones that have been accepted, if you like, are on a database on that website. So in terms of alcohol gel, that's when you're thinking about the content of alcohol, it has to be higher than 60%. In healthcare settings, it actually goes up to 70%, but for community purposes, you want higher than 60%. So it's just a case of having a little look at the back of the bottle. That doesn't necessarily mean it has to be an extremely expensive one. It just, if you look at the bottle, has to be over 60%. How to do one-way systems, and that's very much dependent on your building. You need to think about how many entrance and exits you've got, which are required for fire safety. So you might not be able to open and keep them propped open if they're to do, if they're fire doors. So you need to look at your building, try and work out where the pinch points are. So where your corridors become particularly narrow, where you're trying to access and from where. But I mean, if anybody had particular queries about that, I can have individual conversations if that would help. In terms of getting closer than 2 meters for those with disabilities, so obviously social distancing applies. When you need to be within 2 meters, we would expect you to have a face covering. The definition of a contact within 2 meters is if you've been for closer than 1 meter for a minute, or you've been within 2 meters for a cumulative 15 minutes throughout the day. So even if you have a face covering on, if either one of you test positive for COVID, you would be considered a contact. When you are performing personal cares for that individual with disabilities, you would then be wearing PPE, but whoever is performing that already should be already well versed in what PPE they should be wearing if they're performing those tasks. If it's just assisting, for example, somebody entering an area with a wheelchair or whatever, then it would be your face covering that you would wear. And obviously think about frequently touched surfaces. So if you're holding wheelchair handles and that sort of thing, it's about your hand hygiene. Yeah. No, you don't have to wear a mask if you're engaging in sport or running, because actually anything which increases your respiratory rate, you need to think is going to be restricted if you put a face covering on. Can you share equipment? Yes, if you absolutely have to, and then it needs to be cleaned. So if you're using a piece of equipment for that activity, once that activity has finished, then it needs to be cleaned. So it's a detergent, and then followed by a disinfectant. And that guidance that I talked about before, cleaning in a non-healthcare setting, applies to all these sorts of things. So if you are cleaning a piece of equipment, then it doesn't need to be quarantined afterwards. It would only need to be quarantined if for whatever reason you couldn't use it. So equipment, we would say try and keep away from soft furnishings. If you do have to use for sensory needs, or you know, you do use items that are soft furnishings that can't necessarily tolerate disinfection, that sort of thing. A steam cleaner, if you've got a steam cleaner, is very useful. If you can remove the covers and just put them in the washing machine, that's very useful as well. I feel like I've talked a lot. Does that answer the questions? Is there anything else?
That does from your perspective, Sarah, but I've got a sort of another question I think that leads on nicely, and I will come back to environmental health colleagues. So if this is sort of in a situation where these individuals don't have a known case or known contacts, so it might be just helpful if this is a community group running a tea or coffee morning, and they subsequently know that one of their attendees is a case. So if we could just talk through in terms of cleaning practices, what would they need to do if that happened to them, and actually what would they need to do if they were contacts of a case? So the case didn't attend their setting, but contacts of a case did, because I know that sometimes causes some confusion about what do and when do people need to do what. So I hope I've made those two questions clear that you can answer. So I think the first one is, someone in their group has tested positive and they attended a coffee morning that morning or the day before. What cleaning do they need to do?
Is that me to answer, Emma? Yes, Sarah to answer?
Yes, please. Sarah,
yeah, right. Okay. So if the individuals attended that day, then the cleaning is the detergent followed by the disinfection. So you need 1,000 parts per million of chlorine. So a chlorine based product could be something like household bleach, but you have to dilute it according to the directions on the bottle. So that would, or what you would need to do if they'd attended the setting is to carry out that cleaning wherever you felt they had been. So if they'd sat at a table, outside, been to the toilet, that sort of thing. If it is a contact of somebody, so the individual who's tested positive hasn't attended the setting, but somebody who's then seen them somewhere else has attended the setting, just normal cleaning with the products that you would normally use. So your detergent type cleaning, you don't have to do anything in addition to what you would normally do. Does that make sense?
Thanks, Sarah, really helpful. Environmental health colleagues, do you have anything to add on this particular question point, or do we want to move on? I'm getting a no from Sam. Shall we move on to the next point?
I was going to say, is it worth mentioning about contact tracing if there's a case?
If it's in a setting, but we wouldn't really be looking at necessarily indoor settings for any of this particular at this stage. But if it's an indoor setting, then there might be a requirement, depending on that setting, to use the QR code. So that would fall under test and trace. Is that where you were coming from, Anna, or was that a different?
I was just meaning that if a service user tests positive, then the group might want to see if they've been in a close contact with another user of that setting. So if they fall into the definition, then that person would need to self-isolate.
Yeah.
It might be helpful to cover maybe test and trace and being in contact and stuff at maybe in a later session. I'm just conscious of time as well, so we could do like a deep dive exercise where we could do more about what it is to be a contact, the QR codes and all of those processes at the next session, if that was okay. Tracy, do you want to kindly move us on to the next bullet point and read the next one out, please?
Thank you. This is a latecomer question from, I think it was Val. The deaf community rely on facial expressions and lip pattern for communication. When we restart social activities, would members be required to wear a face mask, face visor? And I asked this question of many of them wear the lanyard that states they are exempt from wearing face masks. What would you recommend in a social setting of possibly 30?
Okay, I'm quite happy to answer this unless anybody else wants to jump in. So obviously, if somebody relies on facial expressions, then you do not have to wear a face mask. But there are also transparent face coverings that a lot of people that I come into contact with do actually use in these circumstances. So you can get disposable ones and you can get reusable face coverings which have a transparent bit at the front that you can use. If you are not using a face covering, then one, we would expect you have a risk assessment for that, and two, you are trying to maximize social distancing at all times. In terms of a social setting of possibly 30, so first of all, you've got to consider your distance that you've got from somebody who's not wearing a mask and interaction with other people. So I'm assuming that this wouldn't affect the whole group, or maybe it would affect some of the group. So it would really come down to how you're setting out where these people are meeting, the social distancing that you can enforce, and when people are removing themselves from talking to an individual who needs to lip read and going somewhere else, then we would expect you to put on a face covering. Does that make sense?
Thank you, Sarah. On the subject of sensory impairments, I actually came across a website, I think it was just yesterday, and I thought this had got some really good information that would be useful to share. It relates to sight impairments, but it actually highlights to people that some others might have hidden impairments. So if you're in a queue and somebody's getting a bit closer to you than you would like, you know, please be mindful that person might have a sensory impairment of some kind. And I know that some sight loss and hearing loss, things like that can go together. So the RNIB have done a sight loss and social distancing quiz, which is a little bit of fun, but it actually is very serious and explains people's experience of living with some kind of hidden impairment. And they've also got some information for businesses considering accessibility, which I thought was really useful.
Tracy, sorry, can I just jump in and just say that I don't think Sarah said anything about visors, but just to be aware that some people seem to use visors in the belief that they're a face covering, but they're not. Those visors, clear visors, are to protect your eyes. So we just need to be really cautious that people aren't using those in place of face coverings, because actually they do no good at all in terms of respiratory droplets. And I've seen loads of people wearing them with the assumption that they do, but they don't. So just to be cautious about that.
Excellent, thank you. Moving on then, and I think we had a question in the chat, but it relates to this hopefully as well. Our playground for under 5s has a maximum of 15 adults with no limit for under 5s. For our additional needs, a limit of 15 children can attend in their bubbles per session. All the sessions are outdoors. Are there any further exemptions? And are we able to have more children per session, or are there any future plans to enable us to start reintroducing more children on per session in the future?
Okay, on this one, as we currently stand, when we get to the 12th of April, it is still a limit of 15, and obviously not for the children, so that's 15 adults. The next stage that looks like it moves along is the May date. So it will still be, and I've had a good look through the regulations on this one, and I can't see any further exemptions. So it is 15 adults up until the next, so it'll be step 3. Where that might be reviewed to, as I understand it, could be 30 at that stage. So that's what I'm seeing at the moment from the information. Let me just double check that that's correct, what I've just said to you. Yeah, so it's looking to increase to 30 from May. So that's where we currently stand on that one.
Yeah, this is a different group. We're an outdoor walking and running group. What will we need to put in place to start our group back up? Is there a limit on numbers? I think these people do a park run, I'm not sure. Do we need to provide hand sanitizers? Do we need to collect data for track and trace? What information do we need, and how long do we need to keep it?
Okay, so on this one, this is another group that is permitted from the 12th, and it doesn't stipulate numbers. What there has to be in place is obviously some controls for social distancing and all the things that we've covered earlier on. Test and trace, so in terms of your QR code and collecting data, that's not necessary in this setting. It's not one of the settings where this is required. It might be something that you may wish to do regardless, just in case there is an issue there, but at the end of the day, this should be controlled by keeping social distancing, keeping in your parties as is set. If you are going to run together, that is in your households only, and obviously you can, because it's a setup and it's a running group, it's given this permission. Otherwise it would be that you stick to the general rule of 6 or your 2 households. Hand sanitizer, again, that's up to your own personal choice. Sarah, feel free to come in on this one, but it is mainly about how you operate the running system, the distance you keep from each other, and just keeping that common sense approach to it, really.
Yeah, I would agree. You've got to think, what are you touching in that scenario? You know, if it very much depends on if you've got anybody signing in or anybody doing anything that interacts with any surfaces. If you're just turning up to a park run and not touching anything, then hand sanitizer isn't a concern.
Thank you. I'm just looking in the chat actually, and Colin asked a question: when will the council make a decision about events in the park, please?
So that is currently being looked at by our safety advisory group. We've had quite a few events that have been pushed through to us and asked for an opinion on. That decision is currently being made by the safety advisory group and is with the managers there. So I'm expecting that you should be hearing something soon, but most of the events now, because the ones that are being asked to be run in the park, they will be going through the safety advisory group process, and that's where we can give appropriate advice on each of those events.
Thank you. And another question: do parking charges apply for outpatients at Pinderfields Hospital?
I believe they were, but I think just to make sure that I've got the most up-to-date information, I'll ask the estate at Mid Yorkshire just to confirm and see what they are operating in terms of the current processes, both in Pinderfields and Pontefract site. So if it's okay, can we send the answer with the notes from the meeting?
Absolutely, thank you very much. I think that's all the questions from the chat, unless I've missed anything. Does anybody else have any questions that they would like to ask while we've got the experts here?
There is one, Tracy, about is the council starting the health walks schemes back up? I'm guessing that might be with our team. Emma, I don't know whether that's with some of the public health teams.
It'll be with leisure services, and we currently wouldn't have that information to hand, but definitely, Tracy, we can find that out and give a response after the meeting.
Excellent, thank you very much. Over 55's provision, is it still a limit of 15 children? That's just coming from, let's have a look, from the ADDI. Sorry, for the over fives provision, is it still a limit of 15 children?
Tara, would you be able to let me know what that's about in terms of provisions? Is that a sporting provision? Is it educational? Because there's different requirements depending on what the setting is. So activities for vulnerable children. Okay, there is quite a lot of guidance. I think what I need to do is to send you the links after the meeting for that one, because it kind of breaks it down into what activities and what adults and etc. what needs to be considered. And I'm assuming, do you want me to do that from the 12th, the next stage? Is that okay? Yeah, our youth clubs. I think, yeah, what I'll do is I'll get you that link. I'll get you that direct link, because it gives you all the information, breaks it down, and also gives you the requirements for what you need to look at in terms of a risk assessment. I'd rather give you the more comprehensive view, so you've got everything to hand, so you can go through that and have regard to it, if that's okay.
Thank you very much. Could we have the next slide, please? We've got a few slides now about the lateral flow tests, which I think it's Colin has been asking about.
So there's sort of two testing offers, and this testing offer that's been shown on screen is lateral flow testing, and this is the testing offer when people do not have any symptoms or are not generally unwell. So this is testing for people that are generally fit, healthy, unwell, and want to have a regular access to testing, and this is the lateral flow testing, which I know we've spoken about before. So there's many ways that people can get access to lateral flow tests. So you can go onto the national website, and you can probably use a postcode checker and find where you can access your lateral flow tests. In Wakefield, we have 3 static sites where you can go and collect some tests and take them home to do them at home. Or you can go to these sites and actually have someone watch you do the test. You do the test yourself. No one does it to you. And then you can log that onto the national system. And that test takes about half an hour from start to finish. And what that test does is tells you if you are testing positive for COVID without symptoms. And we have 3 sites: Wakefield Market, Castleford, Hollywood Lane Day Centre, and Kingsley and Fitzwilliam Community Centre. And this slide just tells you which days they're open and what times they're open as well. And there are staff there to support you through that process as well. Next slide, please. I think I would also say that it's just really important that people use these lateral flow tests at least twice a week at two or 3 days apart. And it's that regular frequency of testing is of most benefit to you as an individual when it comes to testing without symptoms. You shouldn't be using these tests if you've got symptoms. You should be using the PCR tests. And you can book them through the national booking system or 119, and you can get a test for symptoms, and we'd obviously advise that. The other aspect, I'm conscious of time, is that if you test positive using an LFT test at home, then you have to go and book yourself a PCR test. And if that PCR test tests positive, you must remain in your isolation period for 10 days. If that PCR test comes back negative, you can leave your isolation period, but you can only do that if you get a PCR negative test. If you're at a testing site and you're testing LFT tests and you test positive at the site, then the same thing applies. You must go and have a PCR test to confirm that result. And you must do that within 2 days of that LFT test result resulting in a positive test. And then if you do that in that 2 days and that result comes back as negative, you can leave your isolation period. If you don't do that within 2 days and that test result comes back negative, the PCR test result comes back negative, you will still legally be required to isolate. So it's really important, the time factor of getting a PCR test after doing an LFT test. That's really, really important, and a good message to promote that if you test positive on LFTs, you must do a PCR test, and you must do it as quickly as you can do. And then you must stay in isolation if it's positive, and you can leave isolation if it's a PCR negative. So I hope that makes sense and I haven't confused anyone. So this is the Wakefield collection points that are started. So we have several of our libraries, in particular 13 of our libraries in the Wakefield district are now acting as collection points where you can attend that library and collect a box of tests, and LFT tests that is, and then you take them home and you can regularly use them at home. And you can find out which libraries are offering that collection service via our online, our website at the council. And I think that covers a lot of that.
Thank you very much, Emma. I'm also conscious of time, and we've got 2 or 3 questions in the chat. If we could really quickly answer them if possible. We've got one from Colin who says, I'm 76 and it's nearly 12 weeks since my first jab. How do I chase up my second?
If Colin's had his jab with his GP, then Colin would need to contact his GP and ask them if he's concerned that he's reaching that 12-week mark and he hasn't yet received that invitation. But the GP practices are working hard to ensure that everyone is going to be called, and that might be very close up to the wire. So, you know, Colin, you might be 11 weeks and 2 days before you get that invitation. But if you are concerned, you can call your GP. If Colin's a healthcare worker in a healthcare profession, then he would ask his employing organisation and seek help from them to ensure that he has access to second dose.
Thank you. We have another question. Are there any plans to offer frontline police officers the vaccine?
So vaccine rollout is based on age basis rather than occupational basis, because you're at greatest risk at age. So at the moment, the guidance hasn't changed in terms of occupational risk beyond health and social care staff. So currently, I'm sorry, if you're working in the police force, it's just a matter of waiting your turn if you're below the age of 50. But if you're above the age of 50, you are being offered that vaccination opportunity now via the national booking system or through your own GP. And if you're under the age of 50, you know, we're expecting the invitations to go down to those age groups in the coming weeks, and we just have to be patient.
Thank you very much. And the final question from Julie. We have enough space to social distance 2 meters for a knitting meditation group. Oh, Julie, I'd love to join that. Of 15 people, I presume. Do masks still have to be worn at all times, or can they be removed when seated?
So the thing you've got to consider is it's not just about the social distancing, it's about the size of the room and the ventilation as well. So everybody thinks about keeping, you know, 2 meters away, but it does very much depend on where you're meeting. So once you take down your face covering, obviously you are more at risk. If it gets very excitable in your knitting group, although you're meditating, so I'm hoping it doesn't, and voices get raised, obviously that, you know, that has an impact. So difficult to say. It would have to be part of your risk assessment, I think, on where you're holding that meeting and how certain you are that people are actually socially distancing the correct amount, and you are in a well ventilated location. Really, I don't know what other colleagues think. Steve's nodding, Sam's nodding.
Yeah, I'm nodding, Sarah. We could move that knitting group outside in the warmer weather. I think as well, I think we just have to be cautious, isn't it? So these are all sort of benchmarks of where we want to get to, some sort of normality. And I suppose whilst we still have a level of COVID infection, I think if we can all be cautious and take that cautious approach, so if it means that we're wearing our face coverings for a bit longer than we thought we would be, then we probably should do that. As best we can. But yeah, summer weather, please take your knitting and meditation group outside. There's obviously deals with the ventilation and the close spaces there as well.
I think also just to bear in mind that although it may be inconvenient to wear, and not overly pleasant to wear your face covering, conversely, if you do get a positive case and then you have to go down the route of looking at contacts, and it becomes a lot more complicated and a lot more worrying if you haven't taken as much precaution as you can. I think, like Emma says, precaution and just erring on the side of caution is much better at the moment while we've still got, high-ish rates.
Thank you very much, everyone. I'm really conscious that we've gone over time, but hopefully we've answered all the questions. If not, please do feel free to email us at ccc@wakefield.gov.uk. Thank you very much for everyone who's asked questions and for all of our lovely panel members that have answered them so professionally. Thank you, everybody, and hope to see you next time.